I'll demonstrate how we do our extraoral exam. So first thing you're looking for when you walk in or bring up your patient from the waiting room is just checking like their pallor, their skin, their walk, their breath, kind of that, just to see what general health they might be in. And then you'll want to explain what you're going to do. So you'll be like, I'm just going to be doing an extraoral exam today. It just checks for any lumps or bumps or abnormalities. It's like a pre-cancer screening. And then you're going to be like, has there been anything that's been concerning you? Have you noticed anything lately that's been different than your normal? And then they'll either say yes or no, and the guys no. If there has, they're just asking follow-up questions like, when did you start seeing this, you know? And then you just chart it and put it in your notes. Okay, so we'll just get gloves, which you guys are probably always wearing gloves too, right? Yeah, for sure. And then you guys have learned about like the lymph system and stuff, right? Okay, yeah. So we're just checking lymph nodes mainly with this one, and then salivary glands when we're doing that. I'm gonna lift her up a little. So with this, you're gonna start out with your occipital nodes back here. There's a little bump in the back of their head. You can kind of feel it, and you'll bring it down spinal accessory, and you're doing bilateral circular palpation, right? So you're just gonna bring it down, and then from here, I like to go to, you're good. I like to go to the these nodes right above your clavicle, because you have it, yep, supraclavicle nodes, yep, and then I'll go postauricular nodes, so behind the ears, and then preauricular, right? And then I'll have them look to the right or left, both sides. You're gonna do both sides. But then I'll feel, there's your supracleomastoid muscle right down here, and there are nodes that are pretty deep in there, so I'll do little palpations on both sides of that supracleomastoid muscle. And then I'll go to the other, and I'll do it on this side as well. So there's deeper ones, and then there's the superior, these are up here, and then the inferior ones, which are more down here, right? And then I'll feel that, and then I'll just ask, like, is anything tender or sore? Throughout the thing, I'm just asking, making sure there's nothing tender or sore in that. Nothing hurt. Yeah, and then I'll have her kind of tilt her chin down. These are the areas we kind of find the most, like, mobile or enlarged lymph nodes is the submandibular, which our mandible is our jaw, right? So we look under, and we're gonna bring our one hand brings, like, more of her skin. It pushes her skin to one side, so we have more skin to grasp, and we pull it up over that mandible area. So we'll pull it up here, and we're just feeling for any, like, mobile lymph nodes. And if you find anything, you'll just describe it. So you'll say either bilateral or unilateral, submandibular, lymph node. Yes, exactly, yeah. Nextly, I will come to the front, and I will work around the jaw. So I'll palpate around this jawline, because we also have ones there. And then I'll ask her to clench her jaw. With the muscles in the face and the neck, we just check the masseter muscle, and we want to make sure it's, like, even on both sides. So if you have more of an enlarged one, that just tells you, like, for example, I have a patient who has one of the enlarged ones. He's missing a few of his molars on the other side, so he's unable to really bite down on that side. So that's, like, made one side more muscular than the other. Yeah, so I'll take that, and I'll have her clench, and I'll feel it, and then I'll also feel that temporal muscle, right? Our temporal muscles. Okay, and then I'll also have, yes, you're ahead of me. She's like, I know what I'm doing. Okay, I'll go, so do you guys know what a TMJ is? Okay, yep, exactly. So we'll just feel that, and I'll have her open and close to see if she has any dysfunction of her TMJ. And then I'll also have her go side to side. And then you'll just mark down what you feel, right? Yeah. That one's also common when we see in patients. I just had jaw surgery on it, so mine's mostly okay, but if you would have seen me last year, it was, like, fully popping on both sides, so. Yeah, mine pops on my right. And that's because we clench and grind, right? So stressful program, am I right? All right, and then next, so we have our, why am I blanking? Sinuses, yes, we have our sinuses. So this one I especially go like, hey, if you feel anything, because I don't really feel much on the sinuses, it's more pressure on them, right? So I'm like, if you feel anything tender or sore, let me know, and then I'll go and I'll do sinuses under and above, like so. And then I'll also check their larynx and their thyroid. Yes, ma'am. So I like to just go on both sides, and I'll push it to one side. Can you look straight? There you go. I'll push it to one side so that I can feel the other side a little bit better, and just do some forward motion with my palm, and then I'll push it to the other side. And I'll also have her swallow so I can check there. Yep, and that feels good. We're just feeling for any enlargement, because that could indicate, like, hypo or hyperthyroid problems, right? I also like to check the mental, our chin area. So if she swallows here, if it doesn't move, that's good. If it does move, you might have some problems with their bite or tongue thrusting problems there. Yeah. Did I miss anything, Kiana? I don't think I did. Okay, cool. Awesome. And then we'll just go on to the intraoral, and she's going to show you that. What I'm doing is I'm just giving her a pre-rinse. We always do that before going inside any patient's mouth, around 30 seconds, for as long as the patient wants to swish it for the most part. Yeah. So it protects us. Yeah, roughly. Some patients, it's really spicy, and so they want to spit it out almost immediately. And then some can hold it for a really long time. So generally say until you feel like you need to spit it out, that's okay, but you're supposed to do it 30 seconds. Okay, so I'm going to have you lay down, Kate. I'm going to make sure that that light is right in her mouth so you can fully see everything. First thing you do when you come over is you're looking at her lips. So looking around, making sure there's nothing irregular. Usually what you'll see, especially in older patients, is it's called angular cheilitis.
It's right here along her commissure, so like those edges of her lips, where it might be dried down, might be red, might be irritated. Could be some fungal infections going on there because again, saliva gets pulled. Just making sure everything was good. Everything looks really good around the border of her lips, so we're not worried about anything concerning that. So then I'm gonna have you open up, and the first thing, I sit on the right side, so I usually start on her right side. And so you visually look in at her mouth. See these little lines right here? That is, it's called linea alba. That's completely normal. Most patients have it from where they bite through cheeks. So if you notice a white line in the middle, like kind of usually bilateral, so both sides of your cheek, that we're not worried about that. It's called a linea alba, and again, cheek biting. And so you can see it on her cheek, not as big, but some people have huge ones. And so again, you're feeling this right here. That is her parotid gland. When we are doing it, we usually make sure that the salivary gland is working and that saliva is coming out. We don't need to do that for you or anything like that. And so visually looking, making sure there's no discoloration, everything is clear and good. Look all the way up into her vesicle up here. And then also palpating, so feeling along here. You will have, again, that's a salivary gland right there, so you might feel something there. Small, shouldn't be big. You'll know if it's big, hard. Again, the same stuff when you're looking for lymph nodes. Making sure nothing feels good. And then I'm also going to have you turn a little bit that way so I can see, just looking along the gum tissue that surrounds her bone, making sure all of that is even, making sure there is, again, discoloration. We usually are looking for redness, swelling, anything like that that could be indicative of gum disease. That's what we look for. But with you guys, again, looking for anything red out of the ordinary, specifically lesions. That's what you guys are wanting to look for. So any white spot lesions, any little bit of redness, basically anything that you're like, that should be there. That's what you're looking for in marking. And so looking along here, make sure the bone's all the same level. And then I usually go forward to look down along the lip. She has that little bite there, but that's just from biting her lip. You can mark that if you want. Doesn't really matter. And then make sure specifically, because I had a patient the other day who had 2 canker sores bilateral, so on both sides, right here, so 2 little white spots. But you also feel along here, and you have a ton of little salivary glands in this here, so you might feel like, oh, there's some little bumps as you're feeling along. Those are normal, as long as they're not super big. Like if you feel it inside specifically, but you press against when you're feeling firm surfaces, so you use your other thumb so you can fully feel in there. And so you feel along the whole thing, again, visually looking, and then same thing on this left side, fully looking to her cheek. Again, you can see that little, it's kind of like almost a little scar. That's normal, not worried about that. Right there, and then her parotid gland right here, and then looking up, and then I'm going to have you turn a little bit more towards me because I need to see, and then I'm going to use my mirror also because it's the other side I can see as well, just to look up, and then I'm going to adjust my light here, just so I can see up into her vesicle, so like the vesticle area up here above the cheek. Make sure, again, nothing is outside of the. If you are going to find, you could also find some lesions. I found some lesions up here above the lip, so above and below the lip, you often find stuff. So again, making sure everything looks normal, clean, feel along that side as well. So like a full circle all the way around, that's how I like to do it. And then going in, I like to feel her hard palate after this. So that is the whiff of her mouth. It's a little bit ticklish, which Caitlin knows, and then thank you for lifting up. And so you're just feeling along for any soft spots, and then visually looking as well, making sure there's no discoloration, nothing, no little spots, nothing that looks ordinary. This is very clean. That's the coloration we want to see. It's just normal. If it was like super red, super white, those are when you start to get concerned. And if there's any little spots of a lesion there, because you can also find them on the hard palate. But everything here looks good. I didn't feel any soft spots. It should be roughly even all around as you're feeling. And then while I'm here, I am going to look at her down the back of the throat. This can be a little bit hard to see sometimes. Some patients open up really well. A lot of patients don't. So I am going to have, Caitlin opens up really well. I forget. And so you can see all the way back. See her tonsils, see all the area. Should be able to see all the way back. I need to adjust my light. But all the way to the back of her throat. See if there's any redness or white spots on the back. That's what we're looking for. I did have a little bit of that red petechiae on.
I do have petechiae on the back of my throat.
So like little red spots, like bruising and stuff.
It could be from trauma. It could be from strep. You could have some from like the Epstein-Barr virus.
Yes.
So I know mine's from trauma. You just want to monitor it.
Yes.
If you find something there.
Yeah. So keeping an eye on it. You can ask the patient, like, I know why she has that, and so you can ask the patient, like, oh, have you done anything that caused that? Have you been sick? Anything along those lines, just to kind of figure out why.
A lot of people, it'll happen if they have oral sex.
Yes.
They'll have trauma.
So there might be some in the back of the throat. So I'm not worried about that with her because I know why it's there. Yeah, I'm like, I know why it's there, so I'm not worried about that, but that's something you can look for as well, especially in children. Keep an eye on for that. But again, you can see really well all of her little uvula and then all this back there. Again, making sure nothing's out of the ordinary. And then moving to her tongue, what you want to do, this is the area that you're most likely to find the most lesions. If there's any oral cancer, usually it's around the tongue area. So I'm going to stick out her tongue. I'm going to loop it up. I am specifically looking at the side of her tongue, so that lateral border, especially all the way to the end. These are, again, just like taste buds, like different things like that. And so we're not worried about anything back there, but making sure. Yeah, the little, like the white. No, everything's normal. And again, looking around the sides, everything looks good on this side. Same thing. Use your mirror from where you can't see as well to get the whole thing. But I can see her tongue really well. Everything looks normal. And then you want to also palpate. So feeling along her tongue, making sure nothing feels unordinary. And then I'm going to have you stick your tongue to the roof of your mouth, so like up like that. And then you also take a look under her tongue, because right along these areas is also where you often find like something that could be indicative of an oral cancer. And then she's also got her little salivary gland back here, so sometimes you can dry that off. Usually we have contact applicators that we use to feel. And so just looking down under here as well, make sure you got a good light. Readjust it so you can see. Sorry, Kate. It's not going super well, so like open up and then there. But I'm looking and I don't see much. You might just close your eyes for a little bit, it's kind of in your face. But everything looks good. And again, what you want to do here, I'm going to put this in both hands. You want to feel her submandibular gland here as well. And so you kind of just pressure here and then feel along here. Make sure nothing feels unordinary, which everything feels good. Yeah, so so same general stuff, making sure that everything feels soft, normal, no hardness. Make sure nothing's tender as well. That's a big thing.
Sublingual and submandibular salivary glands down.
Yes. And so again, a lot of it is making sure nothing hurts. Everything shouldn't hurt unless you're like really pressing in there. That might cause some pain to the patient, but when you're doing it softly, nothing should be hurting. And so we looked over all of this area. We did need to do, we just were introduced to a new thing. It's called
the Malin Patty score.
So usually you do that while sitting up, but I'll show you down, and then once we move into forward, I might show it again at the end. So that's basically, I already know she's a class 1. So if you open up and look down, I can see her whole uvula. Like, I can see all of that. Her tongue comes out when she sticks out very well. Nice open airway. That's great. Mine, I am a class 2, so my airway is a little bit closed, and so my tongue covers part of that uvula. And so you still have an airway that's open, but might have some trouble. I had sleep apnea as a kid, and so that's something that I specifically look for in myself to make sure that that's open. If you can't see any of the uvula, or if it's like less, you can see that's class 3, and then class 4 you can't see anything. Those you might want to refer them over to yeah, basically, and to make sure that they get that taken care of so they have an open airway, and you go from there. Yeah. So there we would refer them to get that checked to see what Dr. White
wants to say. Some questions you might ask them if you do notice that they have like a class 3 or class 4 with lower airway, like you snore,
have trouble breathing.
Has anyone ever told you to stop breathing
in the middle of the night? So except for sleep apnea, mostly. So that's something new that we are now, like just this semester, we've learned.
Because the tongue is too thick to big.
Sometimes it can be due to an enlarged tongue. If you notice, if you stick out your tongue, you have it a little bit. This is so her tongue is scalloped because she's got a bit of a larger tongue. That means it's been pressing up against her teeth. And so some patients, if they have a really large tongue and a small mouth, you'll notice that scalloped edge along their tongue, and that can be indicative of again, so like harder to breathe. She can open up really well. She also has like a large mouth, so it's like we're not worried about that with you because again, super wide open. But that's something you can pay attention to as well.
Another thing with that is if they have a narrow, like really arched palate.
Yes, so like instead of like wide like this, and more like that.
That can also cause breathing problems as well. Because when you're breathing, right, you're supposed to be sticking your tongue through your mouth like that, and that's where your tongue's supposed to rest. And so if they have that narrow arched palate, they can't stick their tongue as well that way.
Yeah, so that's just something to be on the lookout for as well. Keeping a look at again the end of her teeth, where that's called the retromolar pad, so where her gums meet the teeth right there, and then her maxillary tuberosity, so the same thing but on the top of the mouth. Just using, of course, on this side. So again, pointing this way so you guys can properly see. We just take a look at where the tooth meets the gums here. A lot of times there could be, like at least for me personally, that gets inflamed because I might get like a chip or something when I'm eating. Could go and hit it, and so you just want to make sure that there's no infection or anything going on back there, especially where tooth meets the gums. So both on the bottom and then on the top as well. So just making sure that that's healthy, that it looks visually okay, and that there's no bleeding, and then you can feel it as well, but you're not feeling burning the hair with that. It's right against the bone, so it should be more firm. So mostly visually looking, making sure everything looks okay. Now, is there anything?
I like looking at the tonsils too.
Oh yeah, when I was looking at the soft palate, I also look at that. I didn't say it. She has her tonsils in. Again, you can see. Sometimes you can ask the patient, I'm like, Caitlin, did you ever have your tonsils removed? Did not, and I'm like, good, because I can see them. If you had, sometimes they can grow back, rarely, but it is possible. So you want to ask, like, if you don't see any tonsils, like, hey, did you have them removed? No, they could just be very small.
Mine are enlarged.
They are quite big. They're very easy to see, which is very nice.
Mine have been enlarged since I got strep, so I don't
know. So that depends. I don't have mine removed again, besides sleep apnea is good. So again, it's just more figuring out stuff about the patient. Okay, so moving on. At the end of your appointment, you guys can do fluoride as well. So once we're applying fluoride, pretty simple. Usually we'll do a little thing of explaining the purpose of fluoride. You put it on your teeth. It is a higher concentration than your normal toothpaste. So most of your toothpaste already have fluoride in it, unless it is a different one. And most people know if they have one that doesn't have fluoride. So it's probably hydroxyapatite. Not that that's something you guys need to know. But when we're applying that fluoride, we keep it on their teeth. It's good. They don't need to worry about if they swallow a little bit of it, completely fine. It's not going to affect you systemically. And you can also tell patients, especially if they're adult, fluoride supplements won't do anything for them. That's only effective when you're a child and still growing. So for children, fluoride supplements can be effective. There is a list of like a recommended dose. You can look that up, go over it with them. I don't have it memorized off the top of my head. You can go over that with children, but with adults, fluoride supplements don't do anything for them because their teeth are no longer developing. They're grown, they're completed. And so topical fluoride is what is best. And so that is brushing your teeth and then applying a fluoride varnish. And that's a higher concentration of fluoride. It's basically, I describe it as a shield and a boost for your tooth. So when you are, the way the bacteria works is it has to go through the fluoride, and then it goes to your enamel, and then it goes to the rest of your tooth. So it's like a shield for the shield that your teeth naturally have. And so when we, thank you, I'm going to go put this, I'll hold it in my hand for now.
You can put it on my chest.
True. And so when we usually will explain the stuff about fluoride before we put it on, just so they fully know what they're doing. If they have a pine allergy, often best ask them about that, because a lot of fluorides have the same stuff in them, or similar, so they might be allergic to the fluoride if they have a pine allergy. Yes. Then when you are applying the fluoride, if you have a lot of time, you can do it like the nice way of like fully painting over the teeth.
We told you guys learned how to do it with Carly up and down, right?
Yes. So showing it, so I'll show it on this tooth, so you'd get the full thing, go over the whole thing. You don't want to overdo it because then you're just moving it around, no longer being effective. And so you can do that over the whole tooth. If you are in more of a hurry, it's still as effective. Turn towards the computer to just go. So normally what we'll do is we'll do over the whole teeth more quickly. If you have, depending on the varnish, sometimes you can just go across the whole thing. So like if I was doing the back, Again, it was like going more like this, getting underneath as well, especially on the back. You can go and just go across the whole thing. But if you have the time and if the patient is like has high risk of caries, high step, you can spend more time to properly make sure every surface of that tooth is coated. And then you just go ahead and I am going to retract your cheek a little bit so I can get all the way to the edge. And so, because I want to make sure that I get especially the back teeth, because these are the teeth that are the hardest to reach for a lot of patients. So we want to make sure that we fully get the back of them. And then you want not just to get the front, you want to get, again, that lingual side, so like the back of the tooth as well. So I already hit all those, and so we're just going to go over, I'm going to get all of the back of her teeth over here, and then I'm going to retract her lip a little bit so I can do the other side. So like for these smaller teeth as well, just going over, sometimes if you're in a hurry, this is also effective if you don't have the time to go over individually like that with every tooth. So you can just go across on the smaller ones. The bigger teeth, obviously spend a little bit more time on to make sure they're fully covered. And then once you put this, you always want to give a reminder. So usually I'll go over, like when I'm doing my fluoride explanation, also tell them what they need to know afterwards. And then right before they leave, you let them know again. And so you'll be like, okay, we just applied the fluoride. It might be a little bit sticky on your teeth. I will sit you up so you don't have to be, or you can sit yourself up. You can go ahead and eat food after this. We usually recommend you wait about 30 minutes. Just given the longer that fluoride sits uninterrupted on your teeth, the more effective it will be. But after that 30 minutes, you can eat anything except for foods that are hot or super crunchy. So like no tomato soup, like no hot tomato soup, no Crunchwrap Supremes, nothing like that could remove that fluoride from your teeth. After 4 to 6 hours, you're good to eat whatever you want again. So if you get the patient is in here around 1 o'clock, so that means like they just had lunch, we're not really worried about that. You'd be good to eat whatever you want for dinner. So that's why I tell the patient. If it's right before lunch, if it's around 11 o'clock, I'd be like, hey, by the time you get home, that should roughly be 30 minutes, you can eat something that is maybe a little bit colder, not crunchy, and you'll be completely fine. If they want to brush their teeth afterwards, again, you can tell them, the longer they keep that fluoride on their teeth like undisturbed, the more effective it will be because the more time it has on your tooth. So usually recommend like just brush your teeth again like normal at night after dinner. And then you can drink water as normal too.
And then just follow instructions on your fluoride.
Yeah.
If you guys have a different fluoride, then also might have different instructions.
Yes, but that's generally what most.
We have bigger boxes of them, and it should be a bigger box.
Yeah, so these are just individual. But for the most part, that's the general rule: is about 30 minutes before they eat. But again, that is last. And then roughly 4 to 6 hours before they don't have to worry about the hot and the crunchy foods.
How long should they wait until they can rinse them?
Again, as long as the patient, like the longer they keep it on, the better. Usually, definitely 30 minutes, like before they like brush. It's like they really want. They just can't stand the feeling of that fluoride on their teeth. At least 30 minutes, but recommended that 4 to 6 before they brush it off, just again for it to be most effective. But patients will always do what they want to do.
There are some fluorides that are like water-based.
Yes, and those ones are so nice.
Within 15 minutes,
yes.
So they can brush their teeth
right afterwards.
So
yes, and so maybe in a couple years those might be more commonplace, but for now that's the indication for most general fluoride varnishes. And you'll know when you get the fluoride, just look up what it is for these ones. Most of the time you'll be seeing this, and this is what you'll be using. Okay. Any questions all about fluoride, about looking intraorally in the mouth, anything like that? Okay, you guys want to give it a try?
Let's do it.
Perfect.
Let's
Just do like oral exam to see, actually extra oral exam.
Yeah.
Just to check to see if there's anything on the face. Alright, let's start with neck.
So you can start anywhere, but usually.
Yeah. Yep.
So just have you like put down your chin a little bit. Nice here, right?
Yeah, I start from here and then I just make my way down those spinal accessory nodes. Yep. Just down the neck. So you're feeling every area. Yep.
Can I feel the nose behind the ear?
Yep.
Front.
Yep. Mhm.
And then I'm gonna have him look to the
Yep.
right. Yeah, I'm gonna do the feel
So the sternocleidomastoid. Yep, there you go.
That's crazy, that's what I see.
It's very distinct.
Alright. Look to the right. Anything? Tenderness? Super good.
Clavicular. Mhm.
Super.
Clavicle. Yeah.
Okay, cool. And then let's see what else. So do I feel here?
You can feel from behind, or you can feel from in front, whichever one you prefer. Yeah. Yeah. Perfect. Yeah.
Nose swelling.
Perfect.
And then to feel the
Mhm.
submandibular
Yes.
side, I just have them
Tilt down a little bit.
tilt
Yep.
down, okay? And then push this.
Yep.
He doesn't have a lot of fat.
And I pull it. So you'll push with one hand and pull with the other. So you'll come up the mandible. Yep, like that. Mhm. Yep, exactly.
Just feel the nose. Okay.
Yeah.
I'm very ticklish when you do that to me. Just make sure. Do it harder. Alright. And then,
Yep. And then I usually ask them to swallow right there too. Yeah. Perfect. And if it moves, you know they have a tongue press. If it doesn't move, then you're set with that one. While I'm doing that, I also feel the borders of the mandible too. Yeah. Yep. Yeah. You don't have to have them swallow on those. No. Just feel the borders. Yep.
Alright. And I'm gonna do your face.
Yeah.
sinus.
Mhm. And before I do this, I usually ask, this is where you want to know, is there any tenderness, or if there's any pain, just let me know.
Okay. Yeah, so I'm gonna do basically this anything.
Yeah, 2 fingers, perfect. Yep. Okay.
That's good. All right. Cool.
There's a few more things.
Yeah, I know there's definitely more things, but I can't remember.
That's okay, I'll help you. Think about our chewing muscles.
Oh yeah. Oh.
Yeah.
I was gonna TMJ.
TMJ, yep. When they're doing the TMJ, I like holding my fingers just in stationary and not moving them, because then you're just trying to feel for any popping or crepitation of that jaw, you know, any clicking. Yep.
Cool. That's it for the.
Yep.
All right, let's go straight to your mouth.
Yep. Yeah. You can say swish for 30 seconds. Oh yeah, you'll want to switch your gloves before you go into their mouth, just because they don't really want you with the outside germs on their face in their mouth, most likely. Yeah. So before we even open our mouth, do you remember what we do?
Oh, look at the lips.
Yes.
The lips looks fine to me. There's no cracking at the edges.
Yep.
I can't remember what you call them.
Angular colitis.
Yes. So yeah, sometimes we call them impetigo. I don't know if you know that.
No.
Like the cellular. Anyway, and then open it up. Okay, so I'm just checking everything in the mouth, right? So
Yeah.
I can't remember what I start with, like the teeth. I mean, and also mucosa.
Yes, the mucosa is one of the bigger ones we look at. And we're looking at all of these first just to make sure it's okay to work in their mouth. Because if they have something like not a canker sore, like a cold sore or something, we wouldn't want to work in their mouth because those are really highly contagious. So we'd want to just refer them to another day. Sorry. Okay.
And that's region.
Yep, you want to palpate.
Okay.
You can put the one down if you can use both hands too. It makes it faster. Yep. Do you feel the little dots there? Yeah.
And then, I also need to check out the molars and stuff.
Yeah, you can check the back of the molar. Sorry, the lights are like.
Tongue?
Tongue, yep.
Okay. I'm gonna grab it. Stick it. Okay.
Yeah. You can feel it. Awesome.
I'm gonna have a little bit.
So use one finger in the mouth, and then the other on the 2 fingers on the bottom of the jaw, and you're just gonna feel for those more lumpy major glands there. The one in the front is the lingual, and then the one in the back is more of the maxilla, submaxilla. Throat, yep.
You can also use the tongue, press down on the tongue so you can see.
And you can say go ah, and they usually, yeah. His is really good, yep.
Yeah, the muscles.
And then top of the mouth. Yeah. Yep, you can feel it a little bit there. And then you can also use your mirror to look at it with indirect vision if you have a hard time seeing it. If he's like that far, you can see it. Yep, yeah. Yep. Just the Malin-Potty score.
Yeah, so again, looking and seeing how wide that mouth opens.
Yeah. Yeah, he's good. Yeah, you're good.
You can see all the way to the back of the throat. Super easy.
It's a
Yeah,
1.
it'd be a 1.
Yep. There's no 0, just
Last
1 through 4.
Yeah.
Yeah.
Okay, so when you see that,
The other side has, yeah, right here. Do you see that little flap right there? There you go. There you go, yep. You can use it. There you go, nice.
it's like when you open the yogurt, you know. Like,
Do you have any pine nut allergies? Okay, perfect. Just want to make sure.
gonna feel here.
Yeah. Yep. Did Carly tell you guys we have a numbering system for our teeth? We have a numbering system for our teeth. Yeah. We have all different numbers for our teeth. And of course, the United States has to be different than everyone else with our numbering system.
I'm not like
Uh,
regarding your I mean, that's how you do it. Oh. So do we cover this part yet?
yeah, you can do the occlusal. Yep.
Like just like kind of.
Yep. Actually, those areas get cavities a lot too, especially if people don't have sealants on their teeth, because that's our chewing surface and we can get food stuck in there as well.
Let me if you need a break. Lots of talking.
When you have your mouth open, it's kind of hard to talk in the chair, huh?
Okay, take a break.
Our patients for us sit in the chair for 3.5 hours, and I feel so bad for their jaws. Yeah, we have 3.5 hour appointments.
Yes, you guys are just catching the very beginning of our appointments and the very end.
I don't know, sometimes health history takes forever at the very beginning. You can also use your mirror as well. So in your left hand, you can use your mirror to retract the tongue. I like switching it the other way. There you go. Perfect. And that gives you more room.
Sorry, that's not right. Where would you? You have your spasm. I can feel you like shaking. You okay? Wow, you're really looking much. Maybe I should be a
You should. You can become a dental hygienist. Join us in our program. I don't know. I love working in people's mouths. It's so fun.
Actually, this is my favorite part.
Really? Okay. Fair. That's okay.
I'm not trying
Everyone has their different preferences, right?
I can look at anything, like stomach, buttholes, or like anything, literally.
Yeah.
But mouth, I can feel it.
See,
it's like,
I can look at people's buttholes or stomachs, so that's why we go into different professions. And we need all of us,
also,
right?
Like we had a lot of like anatomy labs last semester, and I love to move around the internal organs of the cadavers and look at it. Kind of gross, but to me, it's fine.
Yeah.
It gross out. I'm like, oh, it's fine.
Yeah.
So the next 30 minutes, just avoid eating anything that's hot. Yeah, and I avoid brushing your teeth. Actually, you shouldn't eat until like probably in the 4 hours. Something like that.
You can eat after 30 minutes with this one, but just remind them not to eat anything crunchy or hot until like 4 hours. Yeah.
And also, you can rinse your mouth probably 30 minutes, but the longer you wait, the better it is. The better the fluorescence and tea and everything.
Nice.
You guys will try if you want to. Okay, thanks for coming in. Thanks for having me.
I'm Jared. I'm a case student. I'm going to do a little extra oral exam. I'll have you tilt your head forward first. Feel some nose.
So I like using scissors when I'm doing it. It just gives a little bit more precision. It's kind of like massage.
All right, go ahead and lay your heads down.
Yep.
Just a little bit.
Yep.
So you like pull.
Yep. So like scoop up. Yeah. And so you're pushing it against where that jawbone is, so you can feel the nodes against it.
Awesome. Turn to look at the TV over there.
Nice. One more towards me. Nice. I should feel better. What other notes do you have?
There's a couple ways you can go.
Like maybe sinuses.
Yeah, you can do that.
Any tenderness as I do this? No. Fight down for me. Nice. Go ahead and open up your jaw. Nice. Open your jaw side to side for me. Alright. Go ahead and punch your teeth and swallow for me. Great. Thyroid. Go ahead and swallow for me. Nice. I also like push on this or something.
Yeah. So you want to push it from one side to the other, and then just I like pushing it and then feeling.
Yep. Mainly just feeling if it feels enlarged. Just like that. Perfect.
Nice.
Yeah, you got everything.
Nice. Now we start the oral exam.
Yeah, intraoral. And then where did the glasses go?
Right there. At your hands.
I was like, where'd they go? I'm like, they're not on the thing. Do you want to practice putting it on?
Sure.
Okay. You grab that end.
Put this around. Any feedback here? Any tips?
Nope, you're doing good.
Did you feel?
I know we saw that.
I was trying to get that back in
I
the
thought
box.
I didn't. I knew you. I knew you would get the
Well,
one.
okay, perfect.
We're so glad. And then you also want to remember to palpate the tongue. Yeah.
Yep.
I'm gonna tap on your palate. Okay, with white.
A lot of my patients will come in with like fuzzy tongues. That just means they need to brush their tongue more. Yep.
Nice. That looks good. And start with something else before.
Back of the throat.
Back of the throat.
Yeah.
Say ah. Stick your tongue out for me.
Sometimes it's hard to see. Yeah.
Let me go look from this angle.
Your score is like 5.
Off the
There you
chart.
go. There you go.
Yep.
Nice. I got a little better.
Yeah. And then stick your tongue out one more time. I'm trying to see if it's a class 2 or a 3.
I think it's 4.
I can't see. Oh yeah, we can't see anything.
Yeah. That's 4.
Yep.
Do you snore? I do. Is anyone-
Yeah. Is there anything else you need?
Nope, that was it. We looked at the back. Everything's good.
All right, Mr. Kai. Fluoride time. And open wide for me.
If you're doing the front ones, it might be better to even just to use your finger. It gives you a little bit more control. Yep. Yep. There you go.
It's also more comfortable for the patient because those mirrors can get pretty intense.
You can take it.
Taste it. You can taste the
Taste it.
flavor.
Oh, gotcha.
It's not a good flavor.
It's okay.
It's okay because we're used to it.
And then to get the inside, we just push his tongue over.
Yeah.
I would use the other side of the mirror. Yeah, there you go.
Yeah. So kind of hook it a bit. It's a little bit easier if you do it that way.
All right, Kai, other side. Oh, we'll do the bottom.
Now you guys will have your fluoride doses for the 6 months.
Get a nice boost for your teeth. Strengthen them up.
Free fluoride. You know, offices can charge $46 for fluoride, and insurances don't cover it. Our office charges $10 for it. This clinic.
Yes.
But
Did you get this like over the counter?
You can also buy it online.
yeah,
So
yeah.
big packets of a whole thing similar to this, and apply it whenever you want.
at home. It might be beneficial for your patients too.
Yes.
If you feel like they,
I'm trying to chip it too.
if they have like a high curious diet, right, like a lot of sugars and carbs, you could totally recommend getting some fluoride for them. They also have fluoride pills, like supplements that children can take.
Yep.
The thing with fluoride is when we have it, and when we're young.
I explained this when you were gone.
Oh, you did?
Yeah, I did.
Okay, cool.
You can go over it again.
No, it's fine. If they got it, I don't need it.
All right.
Perfect.
Last side, the bottom. You ready? Okay, good.
He's doing it in quadrants.
You think it tastes good?
You coming around on the flavor?
I like the orange.
I do like the orange. It's the best one.
Why didn't you guys tell me when I?
We said orange or non-flavors, and I almost said like, why would you choose non-flavored? But you know, we let patients have their choice.
Yep.
All right.
It's autonomy.
Yeah, patient autonomy.
Thanks for respecting.
Yeah.
Yeah, we just finishing that up.